People who have Alzheimer's disease or a related dementia often pose severe management problems for those taking care of them. Managing these patients can be very difficult. To help you manage troubling behavior successfully, we will teach you a method of looking at behavior objectively and how to take specific action to change troubling or difficult behaviors when you need or want to. Patients with dementia may show a variety of behavioral problems, including, but not limited to, anger and agitation, catastrophic reactions, depression, hallucinations and delusions, paranoia and suspiciousness, sundowning, wandering, inappropriate sexual behaviors, personal hygiene problems such as bathing and dressing themselves, and language and communication problems. For example, people with Alzheimer's disease may suddenly become angry or may become very frightened and agitated. Or, when faced with more demands than they can handle, they may have what is called a catastrophic reaction, a reaction that seems too extreme for the circumstances, such as becoming upset to the point of being combative. Patients may be withdrawn and show signs of depression, such as tearfulness and sadness. They may have hallucinations or delusions, see or hear things that aren't really there, or have troubling thoughts and beliefs about those around them that are not based on fact. They may become paranoid, frightened and suspicious of those around them. They may sundown, become especially agitated in the late afternoon and early evening, around sundown. They may begin to wander and endanger their own safety. They may develop inappropriate sexual behaviors, including masturbating or exhibiting themselves in public places. They may have problems with personal hygiene, have difficulty caring for themselves, such as trying to dress, eat, or toilet themselves. And finally, they may have language and communication problems, which can be very frustrating for both caregivers and patients. All of these behaviors can pose serious difficulties for the person trying to provide good care. This tape shows some ways to work with these difficult behaviors in order to care for persons with Alzheimer's disease and related dementias more effectively. Before starting to work with difficult behaviors, be sure that the person's medications or other medical conditions are not causing or contributing the problems, particularly when the behavioral problems seem to begin suddenly. A sudden illness, a new medication or dosage, and any other sudden changes in the patient's life or surroundings can cause behavior change. There are a number of ground rules to consider when managing a patient with dementia. Effective communication is critical. Communication is an exchange of thoughts, information, and other messages from one person to another. It can be very difficult for demented patients to understand and communicate. Communication problems and language deficits may trigger problem behaviors and complicate caregiving. By learning to respond in a helpful and appropriate way, caregivers can help to minimize problem behaviors, such as agitation, tearfulness, or withdrawal. Here are some things to keep in mind and to practice that will help you to communicate more successfully with the patient. Showing respect for the person is very important. Support what the patient can still do instead of concentrating on what they are no longer capable of. A warm and caring emotional tone with a calm, upbeat communication style is important. If you are upset, calm down. Your emotional tone will affect the patient. Be patient. Allow enough time for communication to occur. People with brain impairments may require a great deal of time to understand and respond to you. Good communication involves maintaining compassion for the other person, seeing things from their point of view, remembering to treat the person you are trying to help as you would like to be treated, with kindness and dignity. Dementia can actually cause visual, hearing, and language problems, which further complicate communication. These problems often need to be addressed by better lighting, standing closer to the person, and speaking slowly and clearly. If the patient is having trouble communicating with you verbally, or you are having trouble being understood, try to demonstrate what you are saying. Demonstrate visually. Show them. Finally, if you and the patient are both becoming frustrated, maybe it's time for a break. You can change the subject, distract, redirect, reorient, or simply try again later. Good nonverbal behavior includes eye contact. Look at your patient when you talk with them. Smile, move slowly, gently touch them. This will often help ease communication difficulties. If possible, don't loom or lean over the patient. Before you can deal with behavior problems, you have to be very clear about what the problem is.
They stolen my watch. I hate this place. They are always taking my things. I had it right here and somebody took it.
Yelling.
They're always going through my things. Where is it?
Often, the first step to learning what to do is to learn to observe what is going on as clearly and objectively as possible. Writing your observations down will enable you to see exactly what the problem is. Seeing the problem written down lets you look at it with new eyes. It lets you distance yourself from any feelings that you may have about the problem, such as irritation or anger. And it will allow you to begin to think of solutions with a clear and calm mind. The first step of observation and eventual behavior change is identifying the problem. This means having a description of one specific behavior that is a problem. Try to stick to describing only what you see happening. The second step is to look carefully when the problem occurs and gather information about it. How often does it occur? When does it occur? Where does it happen? And who does it happen around? The third step is to watch the problem carefully and note what happens immediately before and immediately after the problem occurs. Again, stick to describing only what you see. Try to develop a picture of the problem and what leads up to it and what follows it. Observing a problem behavior by recording what the behavior is, what happened immediately before the behavior to trigger it, and what happened immediately after is sometimes called observing the ABCs of behavior. B stands for behavior. The behavior or problem that you want to work on is the first thing you observe and record. A stands for antecedent. This is what happened before the problem behavior. This may have triggered the problem. C stands for consequence. What happened right after the behavior, because of the behavior? As we said earlier, when trying to change behavior, you always start by observing B, the behavior. Then after you have observed the behavior for a while, you need to identify the antecedent and the consequence of that behavior. Observe and write down your observations about the behavior for either a day or two, if it happens often, or a week or two, if it happens less often. It's easiest to work with one behavior at a time, so target just one to watch. By looking at behavior in terms of stages, A, B, and C, you can see how behavior almost always has a trigger, an antecedent, and a consequence, a result, and therefore rarely happens for no reason. Remember, behavior, even in a demented person, results from a cause. It doesn't happen without reason. Understanding this will enable you to figure out what to do to help. In this tape, and those that follow, we will describe this method of understanding and managing difficult patient behaviors. We will provide you with examples of situations that you may find yourself in, help you identify the ABCs, and help you use the ABC process to develop a plan for care. Throughout each example, we will show the problem, show the ABCs, go back to the problem, resolve it, and show the ABCs for the resolution scene. We know that changing behavior takes a lot of time and effort, and we realize that our scenes in these videos are simplified to show you how to identify the ABCs and then go about changing behavior. Once you understand how the ABCs work and how to apply them to a situation, you will be able to use them in the complex and challenging situations you encounter with patients. Let's look at a situation and start with the B, behavior, in describing the steps you'll need to take to change behavior.
You're right.
Look at room 3 is empty.
Yes.
We can put one in there.
All right.
Okay,
Nurse!
and then we can move Mrs. Johnson from...
Nurse!
Oh, my goodness.
Nurse!
Oh, you're so upset. What's the problem?
Fred,
I can't find my room.
Fred,
I can't find it.
we'll find it for you.
Come on, we'll find it. Don't be upset.
Are you all right now?
In this situation, the B, behavior, is the person yelling. The A, the antecedent of the behavior, was the person seeing the nurses and the nursing station. The C, consequence, of the behavior was the responses from the nurses. They talked with the patient and tried to calm him. Here is a quick review of the ABCs of this situation. A, the patient spots the nurses. B, he yells. C, the nurses try to talk to him and comfort him. This is not an unusual situation, and you may have found yourself in a similar one, perhaps even behaving and using the same techniques to calm the patient as these caregivers did. There is nothing especially right or wrong with how they behaved. No matter what technique is used, it is important to understand that how you act, respond, and behave toward the patient influences the patient's behavior. There is also nothing right or wrong with what triggered the behavior. Again, what is important is understanding how it relates to the behavior. Once you understand that, you can change things. Although we don't mean to, sometimes our reactions to behavior can either make the situation worse, or we respond in a way that will almost guarantee that the situation will happen again. While the caregivers in this scene calmed the patient, which was the right thing to do, most likely this behavior will occur again, and they will spend some more time calming the patient down. If these caregivers were to use the ABC method of managing behavior, they might be able to find out what was triggering their patient's outbursts and therefore prevent further outbursts in the future. In the tapes that follow, we will show you other difficult behaviors and how these behaviors can be observed, broken down into ABCs, and changed. There will be times when you try your best to change a behavior, but nothing you try will help. Sometimes there are other factors involved that are not under your control. If you are having a great deal of difficulty in changing a behavior, this may be the case. At these times, getting a consultation with a professional may be most helpful. The important thing is to remain caring and continue to try.